Hi, it's Dr Nicole from Shy Tiger. Let's talk about how to assess a limp in your dog. So limping occurs in dogs when they're not putting their full weight on a leg, and it's one of the most common things that we see as vets. It's really tricky as pet owners sometimes to understand when to take your dog to the vet for a limp and when you can monitor things at home. So let's use Nitro as our example of how to assess a limp. So firstly, what we're going to do, let's watch Nitro walk across in front of us, and we're looking for any subtleties where he's altering his weight bearing, which we consider a limp. The really obvious dogs are the ones that are completely holding the leg off the ground or almost like just toe touching that leg. That's quite clear which leg we're dealing with. But more often than not, the limp can be quite subtle. So they're just slightly altering their weight bearing. So you've often got in your head which leg you think there is a problem with, but don't always assume you're right. And let's go through then what we do to try and feel through all the legs and see if we can localize what the problem is. So once we've noticed a limp, the next thing we need to do is assess the different muscles and bones and the different legs to see if we can localize what's going on. I find the easiest way to do this is to stand over the dog, and I use my hands to feel the two front legs at the one time and then the two back legs at the one time. So as we run our hands down, we're going over the shoulders and you're feeling for any wounds, any pain, any swelling, any heat. Then I'm going over down the legs through the elbows and I'm feeling the inside and outside, and then down over the wrists or the carpus and then the toes. So with the toes, I'm looking to see if any of the toes are swollen. I'm looking under the feet to see if there's any cuts or wounds or anything stuck in the feet, and I'm checking the nails for any broken nails. So we do that with both feet, and then we go back up, feel the neck, then along the back. I find the easiest way to do this is put one hand under the tummy as you go and feel along the back. Don't push too hard, because if they've hurt their back, obviously they'll be sore, but just feel that. And then we're going to go down both back legs, feel over the hips, down over the knees, the hocks, the ankles, and then checking the feet again the same way we did with the front feet. So we're feeling for cuts, we're feeling for redness, heat or pain or swelling. From here, then we need to interpret our results. So what you'll find with a limp is you're either going to find a wound that we need to deal with, so then look at our wound card. If you find you've got a torn nail, then look at our torn nail card. The other more likely scenario is that you find just this non-discriminate sort of mild limp going on, and that's when I would use our move serum and apply that and monitor them. Of course, if your dog seems in quite significant pain when you're assessing them, or they're dragging their legs, or you're just worried, absolutely straight onto the phone to your vet to sort it out. Hope that helps, and if you need any clarification, just reach out to us, email hello@shytiger.com.au.